Well, recently, we made the switch to this new healthcare starting January 1st of 2024. For the first couple months of having this new healthcare coverage, I wasn't in any need of the services. Unfortunately, in March of this year, I found a lump that I needed to have looked at. Just having that comfort and that quickness for my appointments that were going to be coming up, every step of that process has been so smooth in this transition, and it alleviated a lot of the fear for myself and my family, who is obviously supporting me through this scary event. Having this plan has been a godsend for my upcoming journey in my healthcare currently. I was diagnosed with breast cancer. And coming and following that diagnosis, I have had the greatest care. I feel like when I walk in and I say, yeah, I have a PPO, I feel it's like VIP. That's how I feel. And I feel like I'm not just Lena, like I don't feel like a number. It almost feels like a red carpet treatment, if I could say that. And to have that type of care humbles me, because I know that there are so many others that are just not getting that same care that I've been given. So I can't gratefully just shout it out to the rooftops enough that I'm so grateful that my employer made that decision to switch our healthcare. And I should mention that at every single one of these visits that I've gone to, from my CAT scans to my MRIs to my bone scans, to every single visit I've gone to, my biopsy, my mammogram, not one time have I paid a penny, not once yet. And I'm just so grateful. As a single mom, I don't have funds readily available for these kinds of cares right now. So having that ability for Gravy to be able to set up the billing for me and whatnot is just I'm so grateful. And their team, they respond to my emails so quickly. It's absolutely incredible. I've never had healthcare. I've never been sick before, but I've never had coverage on this magnitude, this level. Even mentioning going into even the pharmacy, I haven't paid a penny, and I just have to reiterate that again. But I'm telling you, to be able to go pick up your medicines, I am set. I am a game plan on. I go into my local CVS pharmacy. There's a bunch all over the place, right? But I go into every single one and I get my invoice and my medicine stapled to it with zero. I haven't paid a penny. To have that comfort of walking up to that line and not going, do I have enough? Can I get it? How much is this going to cost me? Because I really need it. It's there. It's right there in my hand, ready to go home. To have the support of my employer, granted, I work for a family-owned operation, okay? So it's a little bit different than sometimes the bigger ones. But I feel like if they're going to care for their employees as much as that, to give them this type of healthcare coverage because of future needs, we may not all need it right away. But to know that it's there, I would stay with this employer for life, no doubt.